As of April 22, 2020, CHRISTUS Southeast Texas Health System is the first healthcare system in Southeast Texas to resume elective procedures and surgeries consistent with the provisions of Governor Greg Abbott's original executive order. And we are doing so under our exclusive COVID Safe Care program. We successfully practice infection prevention every day because the safety of our patients, associates, and physicians is our top priority.
Hello, my name is Thomas Scott Bramer, and I live in Nederland, Texas. I woke up in the middle of January and I had a lower back pain. I thought that I had pulled a muscle, so I just brushed it off thinking that it'll get better. Well, after 2 weeks, it moved into my hip. And once it moved into my hip, it went to my sciatic nerve, and I started getting tingling throughout my leg. The pain is in my lower back. It's in between my vertebra. It's up against my sciatic nerve, which is on my left leg, and the pain is from my waist all the way down to my foot. I decided I was going to get in touch with my primary care physician, and I found out that he was out of the United States. And then I found out that he was quarantined. So then it was a matter of me going and seeing the other doctor, having the pre-assessment done, and then scheduling my MRI. But when he told me it was a cyst in between my vertebrae, that it wasn't attached to my bone, I felt a lot better. My doctor that assessed the MRI told me that the process that I'm going through usually takes 2 weeks from the time I go to my primary care physician to the time I have my MRI until the time that I do surgery. I'm into my 13th week, going on 14 weeks, trying to get this taken care of. This is the first time I've ever seen Dr. Angel, but I was referred to him by several family members that I know that have had procedures done, and also friends. It's been great thus far. They called me on Tuesday morning at 8:30 in the morning and told me that they were opening up the next day, and they had me scheduled for the following Tuesday. And I was happy to get that news because I didn't know how many more weeks I was going to have to deal with this. The amount of pain that I've been through, and knowing that I could get my surgery done quicker than I expected, it was just great news. And they explained that they would be doing the antibody test. So with that being the pandemic right now, that was one of my biggest concerns. And now that I don't have to worry about that, it gives me great relief.
To keep all who enter our facilities safe during COVID-19, we have added the following precautions. A no visitors policy, except essential visitors needed for patient care. Screening everyone who comes through our door. Isolating COVID-19 patients to one area of the facility. Temperature checks for associates. Requiring everyone on our campuses to wear masks. Using telemedicine to treat active COVID-19 patients so their caregivers and support staff limit the number of times they enter their rooms. And constant and uncompromising attention to cleaning and disinfecting. These efforts, combined with select COVID-19 antibody testing for our physicians and patients, allow us to do everything we can to provide the care you need in COVID-safe surgical environments.
Different people are going to have different reactions on whether they're going to want to have their elective surgeries done or not. But I can assure you from my experience that if they're in pain like I am, I would not hesitate one moment about having surgery done. I was actually born at St. Mary's in Port Arthur and had surgeries done here at St. Elizabeth, and I would definitely recommend them.
Many of you have waited long enough for your surgery or procedure. We are answering the call to help our community today and tomorrow. In all that we do, we are devoted to keeping you, your families, our caregivers, and our associates safe. We are here when you need care. We are ready.